Evening, everyone. How's everybody doing? It's Dakota from Dakota's Den. Listen, it's 11 o'clock at night, and I'm just sitting here. I'm not sleepy, so I'm watching TV, and I'm trying not to watch the news because I've been watching the political news all day, and I'm on overload. I am totally on overload. I know every podcaster, I know every newscaster, I know every podcast name, channel, topic. I know them all, and I'm really getting overload. But so I went away from the TV and I said, let me just peruse the internet and see what's going on. And oh my God. Okay, now I had a colonoscopy. Everybody should get their colonoscopies. I had one last week. Oh, it was brutal. It was on a Friday, and I couldn't eat anything on Thursday, and I ate the last time I ate was Wednesday night. And when the lady said to me Friday morning, when is the last time you ate? I said, Wednesday. It was just so weird. I was so weak and tired. But anyway, this goes into the story about be careful when you're at the hospital with these doctors. Listen, there is a doctor who was giving women colonoscopies, and they give you anesthesia, of course, and it's the best sleep that you ever got in your whole life. But this doctor was giving women colonoscopies and anesthesia, and guess what he was doing while they were in the recovery room recovering? Yes, he was sexually assaulting them. You can't go out on the street and find a prostitute to have S with you. You have to take advantage of a patient who's having an invasive colonoscopy. Oh, what is the world coming to? I said to myself, I'm not going to watch the news, but then I end up watching something that was just as bad. Yeah, I can't believe it. I have seen everything now, and I get colonoscopies every 5 years because I have IBS, and it's just something that I have to do. So now I have to look out to make sure that the doctor is on the up and up. I don't know, y'all. I don't know what the world is coming to, but I do have a news clip of this guy. So you guys, well, he's going to be locked up, so you don't have to worry about him being your doctor or giving you a colonoscopy. If I'm not mistaken, in the clip they said 14 women. Are you that warped that you get turned on by an unconscious woman who is trying to take care of her health? That is the craziest thing I've ever heard. All right, so let's just listen to this clip, please, please, because we have to be aware.
He was the first to break the story of a Queens doctor accused of drugging women, including his patients, then secretly recording videos as he committed sex crimes against them. Today, that doctor went before a judge again to face even more charges. And as Chris Glorioso reports, this new indictment involves one of the women who told her story exclusively to the I-Team.
The charges now piling up against this Queens gastroenterologist, and for the first time today, our I-Team camera was allowed in the courtroom as Dr. Cheng learned about this new indictment. Dr. Ji Allen Cheng stood before a judge again Thursday to face what is now his third indictment on charges he used his position as a physician to commit sex crimes against patients and non-patients. In the latest alleged incident, he's accused of sexually abusing this woman who spoke exclusively to the I-Team last fall.
He targets people that are helpless.
She told us she was sedated for a routine colonoscopy at New York Presbyterian Hospital, Queens. But when she woke up, Dr. Cheng was violating her.
I was in the recovery area with the curtains drawn, and Dr. Cheng was giving me a vaginal exam.
The Queens DA says Dr. Cheng drugged and sexually abused.
Okay, so he already gets to go through the back. So I guess he got turned on and said, I want to go through the front. Warped. This is what you call a warped individual. Okay, there's nothing sexy about a woman or man laying on a hospital gurney being tested for colon cancer. There's nothing sexy about that. Let's continue with this crazy clip.
Accused or raped more than 14 women. Many of them, investigators say, are seen unconscious on videos recovered in the doctor's possession. Attorney Nicholas Liakis represents several of the alleged victims.
One of the first victims that came forward was not aware that she had been raped or victimized until she was shown a video by the district attorney's office.
I reached out to the Queens DA. They showed me a screenshot of one of the videos he had, and they asked me to identify myself, and I did.
Many of the alleged victims now suing New York Presbyterian Hospital Queens, claiming the hospital should have detected Cheng's behavior all the way back in 2021 when a 19-year-old patient says she was drugged and raped on video inside a hospital exam room.
See, this is why I don't care if you are a doctor, okay? Men, doctors, lawyers, Indian chiefs all have feelings, and they all feel like they have needs and wants and whatever. But this is why you should always have women running around, circling around, working, doing this, doing that, when we're in a hospital and there are people who are going to be unconscious, men and women who are going to be unconscious. You should always have women around. I remember back in the day when I used to go to my GYN doctor, I had a male GYN doctor, and there was always a woman that came into the room with him. Always. Now, I've had a woman doctor for the last 20 years, so I don't know if they still do that, but it has to be done. Let's continue with this clip.
I am scared. I no longer want to go to hospitals.
New York Presbyterian says the hospital fired Cheng after learning of the criminal case and issued a statement saying the crimes detailed in these additional charges are horrific and we are deeply sorry for all the victims and their families have endured. We've continued to work with the district attorney to advance the investigation and see that justice is served. Dr. Cheng has pleaded not guilty to all charges he's facing. He's being held without bail.
And how old does he look? How old does this doctor look? Maybe 35, maybe 40. I don't know, but that's a sin and a shame. He's ruined 14 young women's lives and plus his own. Not to mention his parents. You know, they were proud of him because he was a doctor. It's just a bad thing all the way around. And I just picked up on this video because, you know, I had a colonoscopy. And wow, if something like that happened to me, I swear to God, I don't know what I would do. I would lose my mind. I don't know what I would do. I don't know what his problem is. Some kind of warped control, psychological issue that could have been avoided if there were other women just buzzing around. Just buzzing around. There's always a woman buzzing around the hospital room, a nurse, a custodian, the people who register you. I mean, there's always a woman around. How did he get away with doing this 14 times? And he's a decent enough looking man. I'm pretty sure he could have gotten a woman, a free woman, a prostitute, whatever he wanted. I'm absolutely positive. I just wanted to bring this to you guys. It's very, very disturbing. And here I am, stressed out again, because I said, well, tonight, I'm not going to look at politics. I'm not going to look at Trump. I'm not going to look at Musk. I'm not going to look at anything. But I end up watching something anyway. Okay, everybody. I just wanted to bring this to you guys so you can be aware of when you're in a hospital. You know, doctors are doctors. Some are women, but some are men too, and they are men. And I just don't know what to say about this. It's really bothering me. Okay, well, It's 11:36 p.m. here in Pennsylvania. So I want everybody to please give me a thumbs up, like, share, and subscribe because you guys know I'm a new channel and I'm trying to grow. And I appreciate you spending this time with me tonight. And I will talk to you guys later. Bye.